Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Cross River Governor Ben Ayade pushes for the establishment of vaccine production plant in Nigeria. Kano Task Force intensifies COVID-19 enlightenment and enforcement. Arrests 20 citizens of the state for contravening NCDC protocols. And scientists develop booster jabs to tackle COVID-19 variants amid concerns about the Oxford AstraZeneca vaccine's efficacy against the South African strain. Last night, 5 states recorded more community recoveries in line with the guidelines, according to the Nigeria Center for Disease Control, NCDC. The center continues to drive the response, including updating the patient's handbook for the home-based care of mild COVID-19 cases, which includes infection prevention and control measures for household members during care and home-based techniques to manage symptoms. Now, Edo State registered the highest with 360 community recoveries, followed by Edo State with 138. Plateau State recorded 121 recoveries. 89 were recorded in Imo and 38 in Kano State. Meanwhile, there was a drop in the new cases as 19 states and the FCT recorded 506 cases. That's according to the NCDC. Other states, the cases were led by Ondo, as you can see there, which recorded 90 cases. Kwara recorded 89, Rivers in third place, 53 cases. However, the NCDC says that 20 more deaths have been recorded across the country. Till date, the figure stands at 139,748 cases confirmed, 113,525 have been discharged, while the death toll stands at 1,667. The Cross River State Governor, Professor Ben Ayade, is calling on the federal government and the Presidential Task Force on COVID-19 to be careful when bringing in COVID-19 vaccine following the storage challenges. He calls for the setting up of an immediate vaccine production plant in Nigeria, where serums of recovered patients can be worked on with the support of relevant agencies, professors in the field of study, the relevant field of study for local vaccines production. He mentioned this in Obudu, the local government area in the state.
There are third-party philosophies that tend to suggest different agenda for this vaccine. But as a nation, I think that we should be very cautious with the choice. There are different types of vaccines. There are some of them that are using attenuated vaccines. So if it's attenuated, it means you have attenuated their life forms. So you need to store them in that deactivated form at sometimes at minus 80 degrees. So where is the facility for that storage? And if you don't meet that storage in the transport chain and you get a deactivated antigen to become active, it becomes a source of pathogenicity. And you cannot control the virulence because it has gone through a shock treatment for which is going through a recovery. And that's why you're having different strains. I think that what this country should do, truly, is to focus and emphasize on setting up, on the immediacy, a vaccine production plant. And just work on the serum of those who have recovered. And we have thousands of recovery.
Meanwhile, outside Nigeria, South Africa has suspended the rollout of the AstraZeneca COVID-19 vaccine, which arrived in the country just last Monday. Early scientific data released on Sunday by the health minister revealed that the vaccine offered just 22% efficacy against the second variant of the coronavirus, the IE501YV2, which was discovered in the country in October last year. The health minister announced that a team of experts would give guidance on the way forward with this vaccine.
Africa mutated to develop a variant which alters the spike protein of the virus. The virus has also been assessed against, the vaccine rather, has been assessed against this variant for effectiveness. The results suggest that the variant has significantly reduced the effectiveness of the virus on mild or moderate infection, and we are uncertain about the impact of the vaccine that it will have on hospitalization, severe diseases, and death. Excuse me. This means that what we will take from Professor Shabir Madhi is that some more work needs to be done on this issue, because the results from other countries have been quite satisfactory, but there are issues in South Africa that we need to study a bit more.
So I think there are two issues that I would like to pick up on. The first issue relates to interchangeability of vaccines, and those sort of studies are already underway in the United Kingdom, where some individuals that received the AstraZeneca vaccine will probably be receiving the Pfizer vaccine as a second dose. And probably within the space of the next 6 weeks or so, we should get some data with regard to the interchangeability of vaccines. And it might well be that in South Africa, that we also explore the interchangeability of vaccines, including possibly the J&J and AstraZeneca vaccine. The other important issue, which I think I would like to bring to the fore, is that it's very likely South Africa, unfortunately, will experience another resurgence in next, probably in 3-4 months, when we head into the winter period. And the question that we need to ask ourselves, in the context of knowing that the COVID-19 vaccines, both the AstraZeneca as well as the J&J vaccine, are safe, foremost that they are safe. And even though there are question marks in terms of the effectiveness of the AstraZeneca vaccine against severe disease, do we want to take the risk of not vaccinating high-risk groups now, knowing that we're not going to cause harm, but that they might be protected against severe disease? So I think it's an important question that we need to address, and I think it somewhat would be reckless for us to decide just to discard of the 1 million doses of AstraZeneca vaccine that is available, with a biological probability that those vaccines might still be useful in terms of protecting against severe disease. So we might want to reframe our target group for vaccination in the next few weeks, few months, but it really needs to be focused, centered around the prevention of severe disease and death from what will likely be a resurgence sometime soon.
Well, we have more on that story later in our global updates. But let's go over to our Abuja studios, where Dr. Chijoke Kaduru is with us, a public health physician. Thank you for joining us on the program. Let's talk about the second wave and also the new strains. How much of a threat do you think it is, and not just in Nigeria, world over, in the fight against the pandemic?
Oh, thank you very much, Millicent. I mean, I think that we can all recognize that the data has shown us that the second strain or the variant strains that we're seeing are a bit more transmissible than the initial strains of the virus, which essentially makes them that little bit more dangerous for everyone. But I think that the ultimate realities for us are that we have to circle back to the mechanisms, the non-pharmaceutical interventions, and all the preventive guidelines that have been put out for us. Because, I mean, whether it's the first strain or it's the variant, I mean, the variant that we're dealing with, if we abide by the guidelines of, washing our hands with soap and water for the recommended time length, as well as wearing our face masks over our noses and our mouths, and maintaining the distance as much as possible, I think that puts us in a good position to be able to control this. And I think it also just highlights the even bigger need for global solidarity, because at the end of the day, if we have one infection going on in any country, none of us is ultimately safe anywhere else.
Talking about global solidarity, I mean, what do you make of the delays being experienced in vaccinating the African continent? For example, the UN Secretary General believes vaccinating the vulnerable frontline workers first would ensure equitable distribution, especially by richer countries, because then other countries can have access to the vaccines. What do you think?
I mean, I think in general, it's quite disappointing to see that, the uptake of the vaccines globally is predominantly in the high-income countries at the moment. And we will all continue to advocate for more equitable distribution and equitable access to the vaccines. But we must also recognize all of the efforts that are currently going on into sort of pushing through with that equitable access. I mean, efforts like what we have with the COVAX facility are instrumental to making sure that low and middle income countries, including Nigeria, would ultimately be able to access the vaccines that we need as well.
Only yesterday, I mean, we heard as well South Africa health officials saying they're pausing the country's rollout of AstraZeneca. after the study showing that, it wasn't, in terms of its variant, it wasn't of much help, 22%, I believe. Looking at perhaps Nigeria and our strategy, what do you make of our choice of AstraZeneca?
So I think it's important for us to recognize that every country has a very unique outbreak going on in the country. And so, each country has to take, a look inwards and make a decision for themselves. So I think it's not generalizable, a decision that South Africa has made, and it's not going to apply. It's not a one-size-fits-all paintbrush that we're going to use to say, hey, every other country has to make that exact same choice. We have to recognize that South Africa has arguably the highest mortality from the COVID-19 virus in Africa. And that also means that their decision-making has to be different. Also, the number of cases that we've seen of the new variants in South Africa are also very different from what you have in Nigeria. What's important is that in Nigeria, the decisions are following the science, the decisions are data-backed, and they're being made in the best public health interest. And that's what really is important for all of us.
What more do you expect our approach should be, especially to selections for vaccination, the age range, the number of people with the 16 million AstraZeneca that we're expecting?
I think that there's already a country action plan that clearly prioritizes health workers in the first phase and then goes on to look at people who are elderly and above 50 years old, and ultimately people with comorbidities and then other risk groups. We have to recognize, again, that these decisions are being made with a review of the science. They're being backed by what is global best practice, what are recommendations from WHO, and also what are in-country considerations as to what makes the most sense for Nigerians across board. So I think that we have to just work with that prioritization list, because it's completely evidence-backed, and that's what will be in our ultimate best interest. You have to also remember that quite a significant proportion of health workers have been infected with COVID-19, and they are the front lines. They've been there providing care, and ultimately protecting them also ensures that the entire health system doesn't collapse. So it's important that we're prioritizing with all those kinds of thoughts and considerations in mind, right? So I think that for Nigeria, what matters is that there is a country strategy that recognizes all of the global best practices and what is in the best public health good.
We appreciate your time. Thank you so much, Dr. Chijioke Kaduru, public health physician. Thank you for joining us on the program.
All right, thank you very much, Millicent.
Over to Kano State, where Security Task Force for the Enforcement of COVID-19 Protocols has arrested 20 people for violating safety guidelines of non-compliance to the use of face masks in public places and motor parks. During a routine enforcement inspection, the managing director of the Kano Road Traffic Agency confirmed that those arrested will be prosecuted in accordance with the law.
The issue of lockdown was discussed at the security meeting, and the governor was advised that enforcement of face masks should be the first alternative. So those that are not complying definitely will face the wrath of the law, and I hope they will not dare this task force committee, because it is all about our health. Definitely we are going to lock some of our markets. Quarry, Sabongari, Singa, the major markets, from what the report available, we have problem with some of the marketplaces, and we will go around to see, and we have put our men on intelligence report. Any market that did not comply with this protocol, COVID protocol, we definitely shut down that market until we sit with the leadership of that market to make sure they are complying with the protocols of the COVID.
According to the Edo State government, a target of at least 300 coronavirus tests for residents will be conducted on a daily basis in a bid to detect positive cases early enough for effective treatment. The Permanent Secretary, Ministry of Health in the state's COVID-19 update also confirmed that over 30,000 tests have been conducted since the first and second wave of COVID-19.
We have our collation centers spread across the 18 local government areas of the state, and the locations are being publicized for us to easily walk into and have our samples collected and then sent to the laboratories for testing. We are also collaborating with the private sector, the private health facilities across the state to ensure that they also assist in collecting samples. And from there, they are transmitted to our collation center and thereafter to the molecular laboratories that are across the state. It is important to state here too that we have ramped up our testing capacity in the state. And currently, we are doing a lot in terms of the number of samples we test every day. We are almost hitting a total of 300 samples being tested every day currently. And that is actually helping us to ensure that we have detailed information as to what is really happening in the state.
A few European Union countries have taken steps to distribute special passes to allow citizens inoculated against the coronavirus that causes COVID-19 to travel freely. Denmark has said it would go ahead and develop by month end a digital COVID passport that would help its citizens travel to countries requiring a vaccination and also allow them visit restaurants or attend mass events. Sweden also announced this week that it would launch such a pass in time for the summer season. Meanwhile, other European countries such as France, Germany have voiced their concerns about the so-called vaccine passport on the grounds that it would mean special treatment for a privileged class of citizens to the detriment of the younger population. So with the first COVID-19 vaccines weeks away in Nigeria, the question has been raised by the PTF on how this might affect travel in the future. Joining us here in Lagos is Mr. Harry Obey, the Director, Women, Children, Vulnerable Groups, the Department of National Human Rights Commission, NHRC. Thank you for joining us on the program.
Thank you. It's a pleasure to be here.
All right. Should that be a COVID-19 vaccine pass, as countries struggle to curtail the spread of COVID-19?
Yeah, whether there should be a pass or not is a priority or it's at the discretion of each country, because that's an issue that has to do with free movement and things like that. Eventually, we're going to get to a level where such pass may be necessary. But then the timing is important, because if you have not vaccinated the whole population and then you're restricting movement and you say you want to give those people that have taken the vaccination the privilege to move freely, while others that have not taken it, not because they refuse to take, then those ones will be restricted. Then there could be some human rights issues there. Like privileged treatment for some people or discriminated treatment against some other people. So those are issues that need balancing, properly.
Some people have argued that since we already have the rule that says you must provide the negative COVID-19 test before boarding, shouldn't that be sufficient? Why make it, even though it's meant to be voluntary, it now becomes mandatory for you to have for you to go into a country that is demanding of the pass?
Yeah, the measures put in place sometimes need to be progressive, because we're dealing with issues of public health emergency. And so if by the judgment of the regulatory agencies, the government thinks that they need to progress from a particular form of restriction or measure to another, then they have to see whether it is far-reaching enough and it is protective for the general public. So for now, we have not reached the level of vaccination to say that majority of people have been vaccinated. So tendering a negative test result may be sufficient. But I can imagine that we are likely to progress to a level where you need to show that you have been vaccinated to be able to move freely. So at the point that the restriction or the pass restriction need to be flagged depends on each country and at what level of achievement with regard to vaccination or the measures they have put in place.
Looking at perhaps Nigeria's case, we're still expecting the vaccines. We still have a number of people who feel that they will not be taking the vaccine. What's your take on perhaps how much the government is progressing with that education about the importance of the vaccine?
Yeah, the government needs to step up whatever they are doing to assure the populace that, look, the vaccination is necessary And because there's a lot of conspiracy theories going around, some people say it's not safe, others say that it is man-made and programmed to do certain things or the other. So government need to step up their sensitization and advocacy to assure the populace that, look, the vaccine is healthy, and so you can go out, take the vaccine when it is available. And this is where the roles of government agencies like NAFDAC and other agencies need to actually come on board to assure the population. There also has to be some form of leadership by example. So the leaders in these places can come up and take the vaccination to assure the populace that, look, it is safe. So if I can take it, you should feel comfortable to take it as well.
All right, we appreciate your time. Thank you so much, Mr. Harry Obey, Director, Women, Children, Vulnerable Groups, Department of the NHRC. Thank you for joining us on the program.
Thank you, Melissa. It's a pleasure to be here.
Now, some scientists in Britain think all hope is not lost. This is concerning the efficacy of the Oxford AstraZeneca vaccine on the South African variant of the coronavirus. Well, let's bring you more on that on our global update.
The key thing is...
Dr. Mike Tilsley says while it does not appear that the Oxford AstraZeneca vaccine has any less effect at preventing severe disease, the case is not the same with mild cases.
What we're less sure about is how effective it is against mild and moderate disease. And that means that people who have the vaccine could potentially still be infected and still pass the virus on if they get infected with this South African variant. So it is a concern, but we do need to get a little bit more data before we know what the real risks are in terms of the South African variant and protection from the variant with this vaccine.
Britain has urged calm, citing evidence that the vaccines prevent grave illness and death, while AstraZeneca says it believes its vaccine could protect against severe disease. Health workers in Spain are buckling under the emotional toll of treating COVID-19 patients. The country has been among the worst hit countries with around 3 million cases and more than 61,000 deaths. About 45% of healthcare staff in the country were at high risk of some type of mental disorder after the coronavirus first wave, according to a recent survey of 9,000 professionals in 18 hospitals. It also showed 3.5% of them had suicidal thoughts. France's Health Minister, Olivier Véran, was vaccinated earlier today at a vaccination center in the city of Melun, in the Paris region. Véran, who was visiting the center, was asked to his surprise whether he wanted to get the AstraZeneca jab, after asking whether he wouldn't deprive anyone of the shot. He agreed. Finally, Australia is reassuring citizens over the efficacy of the AstraZeneca COVID-19 vaccine after South Africa suspended its use because data showed it offered limited protection against a new strain of the virus. Australia's Minister of Health, Greg Hunt, said the vaccine is effective in its primary objective. The country has ordered 53 million doses of the vaccine, the vast majority of which will be manufactured locally by CSL Limited.
For more updates on the pandemic, take a look at our website, channelstv.com. It has the latest updates. All you need to do is log on and you can access the news. There's several other stories as well, politics, sports, business, coming in from Africa and the rest of the world. That's the program this evening. Thank you for watching. I'm Millicent Nwaka.